we age, I think it's important to understand the different layers to the face and the changes that each layer undergo and the optimal treatments to reverse these changes. So, innermost layer is the skull. So as we age, the skull undergoes a number of changes and essentially shrinks. Now when I say shrink, it doesn't shrink like a football, it just gradually decreases in size. And certain areas increase in size. So for example, the hole for our eye increases in diameter from here to here. The hole for our nose increases in diameter out this way, and this results in lack of underlying support to the tissues. Equally to one of the areas that undergoes most resorption is the cheekbone, which resorbs backwards and leads to a flattening of the mid-face, and the jawbone, it decreases in size in all directions in that it shortens in length from back to front, but also shortens in length from top to bottom. The net result of this is, together with the loss of the deep fat pads which are stuck to the bone, we lose underlying support. So essentially, if you think of it like a table with a tablecloth that fits snugly against the table, and then you shrink that table, the tablecloth will then drape the tablecloth, in this case being the overlying structures. So the next layer out then is the muscular layer, or SMAS layer, which consists of muscles and fibrous tissue. So that layer then becomes overactive as a result of the loss of underlying support. So, and that coupled with the fact that we lose collagen and elastin from the skin and lose that ability to bounce back, leads to the formation of lines and wrinkles on the surface of the skin, which we commonly see in the forehead, around the eyes, in between the eyes, and equally too in the lower face, it leads to downturning of the corners of the mouth and an upturning of the chin. Above this layer then, so immediately under the skin, we have another layer of fat. Now within this layer, each of the fat, or each segment of fat, is divided into a distinct pocket. And some of these pockets increase in size. For example, the nasolabial fat along here, which can sometimes look like a little sausage, and the gel fat here, they both increase in size, but in most places there's a decrease in size of the fat pads. And what that leads to is essentially little hills and valleys on the surface of the skin. So we lose that smooth contour to the surface of the skin. So, and then the skin itself, as I alluded to, loses collagen, elastin, hyaluronic acid, etc. So it loses its elasticity, its tensile strength, and its hydration. So in order to get an optimal treatment result, we need to address each of these layers individually. So what we do is, to restore deep structural support, is we use a strong filler deep down onto the bone. To dampen down the muscle activity, that's where we generally use toxins such as Botox. And then to restore the lost fat in the superficial fat layer, we'll use a thinner filler just under the skin, which moves with the tissues to maintain a natural look.